Registered nurses at Backus Hospital in Norwich answered the call when their union reached out for volunteers to travel to the hurricane-ravaged U.S. Virgin Islands. They joined over 24 caregivers and AFT nurses and health professionals as part of a partnership with the Clinton Global Initiative, Airlink, and the Community Foundation of the Virgin Islands. There they helped teachers and school nurses on St. Croix, St. Thomas, and St. John provide vision and hearing screenings for more than 9,000 students.
So our union president, Sherry, reached out to all of us and just wanted to know if anyone would be interested in going. So before we even knew if we could get the coverage or anything, no other details, we all just kind of said that this sounds way too good to give up. So we reached out to people to see if they were willing to cover, and it was awesome to see our coworkers that couldn't go so willing to help us.
I never realized how big the union was. We had people from Washington State, Montana, Ohio that flew all the way across just to come down with us. So people sacrificed travel time, family time, everything to come down. So it was awesome to see everyone come together and help out a great cause.
We saw a lot of the destruction that went on, roofs that were still, falling down. Doors on the schools were, still falling off. All kinds of destruction, which I'm sure is better than what it was in September, but it's still a lot to be done,
There was a lot of help with the teachers getting the children to us, the administration getting us rosters in a timely fashion so that we could really get going and working as quick as possible. Everybody was really happy. The children were just thrilled to see us. So many of them would come up, run up to us and give us hugs because they just, pretty much knew they weren't forgotten. So that was great.
The teachers definitely had some students that they knew needed these screenings because they weren't thriving as well in class. They were having trouble reading, and it was pretty amazing to see because a lot of these reasons that the students weren't performing well in class, wasn't that they couldn't perform. It was just that they had difficulty seeing because they needed glasses, or they were actually deaf in one ear, which had never really been picked up.
I think it's always opens your eyes when you can help other people that are less fortunate than you are. Makes you feel good. And I've never done a mission before.
I always knew I wanted to do a mission trip. It was kind of something that was always bred in my soul that eventually one day I wanted to do a mission trip. And the opportunity came at a really good time because I was able to get the time off. So I bit the bullet and I went.
All of our different little unions came together to bring that about and to bring the teachers union in St. Thomas together to be able to complete this it was a lot of little pieces working together. It was great. And then because the union is so large, they were able to bring in all of that other help to actually get things paid for so we could be there.
So I didn't want to rub it in, but they definitely knew how awesome it was from our photos and everything. And some of them were saying that maybe next time they'd like to try to go if they can.
I became a nurse because I like to help people. So to be able to have an opportunity to go down to an island and help out people in need, especially, I'm not going to lie, the warm weather was definitely a plus for this. It was definitely a great opportunity to go down there and visit and see what it was like and help out.
Backus Nurses Care.